Did you know that by age 80, nearly 8 out of 10 men will experience prostate enlargement? Yet most don't realize they can take control of their prostate health starting today. Hello, my dear friends, and welcome back to our health family. I'm Dr. Catalin Kari, and if this is your first time here, I want you to know that this channel is all about empowering you with the knowledge you need to live your healthiest life. Please hit that subscribe button and ring the bell so we can continue this journey together. Your support means everything to me, and together we're building a community that truly cares about each other's well-being. Don't forget to give this video a thumbs up if you find it helpful, and I'd love to hear from you in the comments. Let me know where you're watching from today. Today we're having an incredibly important conversation that could change the trajectory of your health. We're talking about prostate health, and I promise you, by the end of this video, you'll have actionable steps that you can implement immediately to protect yourself and the men you care about. Let me start with something that might surprise you. Over half of all men over 50 will develop symptoms of benign prostatic hyperplasia, or BPH, as we call it in the medical field. That number jumps dramatically to 80% by age 80. But here's what I want you to remember, and this is so important. Many of the risk factors are completely within your control. I've been working in urology and men's health for over 2 decades, and what I've learned is that prevention is always better than treatment. That's why I'm here today, to share with you the evidence-based strategies that can help you maintain optimal prostate health throughout your life. Whether you're in your 40s, thinking ahead, already experiencing some symptoms, or caring for someone who is, this information is going to be invaluable. We're going to cover everything from understanding what your prostate actually does, to the specific foods that can protect you, the exercises that make a real difference, and even which common medications might be working against you. Let's start by understanding exactly what we're dealing with. Your prostate is a small walnut-sized gland that sits right below your bladder. Now, I know it might seem small and insignificant, but this little gland plays a huge role in your reproductive health and overall quality of life. Its primary job is to produce seminal fluid, which nourishes and helps transport sperm during ejaculation. When we talk about benign prostatic hyperplasia, we're talking about a non-cancerous enlargement of this gland. Now, I want to be very clear here. BPH does not mean you have cancer. However, it can significantly impact your daily life in ways that many men find frustrating and concerning. What happens is this: enlarged prostate begins to squeeze the urethra, which is the tube that carries urine from your bladder out of your body. Think of it like putting pressure on a garden hose. The water can still flow, but it becomes restricted and much less efficient. The symptoms often start subtly, and many men dismiss them as just part of getting older. You might notice a weaker urine stream, more frequent trips to the bathroom, especially at night, difficulty starting or stopping urination, or that feeling that your bladder never completely empties. Sound familiar to anyone watching? Here's what concerns me as a physician. If these symptoms are ignored, BPH can lead to more serious complications. We're talking about urinary tract infections, bladder stones, and in severe cases, even kidney damage. That's why I'm so passionate about having this conversation with you today. Now, let's talk about why this happens. The exact cause isn't completely understood, but we know that hormonal changes play a major role. As men age, the balance between testosterone and a more potent hormone called dihydrotestosterone, or DHT, begins to shift. This hormonal shift triggers the prostate to grow. But here's where it gets really interesting, and where your family history comes into play. Genetics play a much larger role in prostate health than most people realize. If your father or brother has experienced prostate issues, your risk of developing BPH can be up to 4 times higher. This isn't just about shared habits or lifestyle choices. This risk is literally built into your DNA. I see this pattern frequently in my practice. African American men, for instance, tend to develop prostate issues earlier and more aggressively than other populations. If you have multiple relatives who've been affected, especially those diagnosed at a younger age, you need to be extra vigilant about your prostate health. But here's what I want you to understand, and this is so important. Having a genetic predisposition doesn't mean you're destined to develop BPH. Your genes load the gun, but your lifestyle pulls the trigger. That's where you have power, and that's what we're going to focus on today. Let's dive deeper into those hormones I mentioned. Testosterone and DHT are the main players in this story. The conversion of testosterone into DHT is controlled by an enzyme called 5-alpha reductase, and this becomes increasingly important as we age. Even small shifts in these hormone levels can have a profound effect on your prostate. Higher levels of DHT cause the gland to grow, while decreasing testosterone levels make the prostate more vulnerable to enlargement. It's this delicate hormonal dance that often triggers the first signs of BPH long before symptoms appear. What makes this even more complex is that hormones don't act in isolation. Your genetics, lifestyle choices, medications, and even other health conditions can influence how these chemical messengers operate in your body. This brings me to something that many men don't realize. Metabolic syndrome, which includes conditions like diabetes, high blood pressure, and obesity, has a direct impact on prostate health. Studies show that men dealing with these conditions are at significantly higher risk for developing BPH. It's not just about the numbers on your scale or your blood pressure reading. These factors create chronic low-grade inflammation in your body, which can promote abnormal cell growth in the prostate. Men with poorly managed blood sugar or high cholesterol are often unknowingly fueling the very process that leads to prostate enlargement. One major study found that men with metabolic syndrome had a 70% higher risk of BPH symptoms compared to those with healthier metabolic profiles. The connection between high blood pressure, excess body fat, and insulin resistance creates the perfect storm for prostate problems to develop and progress. But here's the empowering part, and this is why I love what I do. Understanding this relationship gives us a clear path for prevention. By taking steps to manage your weight, control your blood pressure, and regulate your blood sugar, you can significantly reduce your odds of experiencing prostate enlargement. This is where lifestyle changes become incredibly powerful, often more effective than medication alone. Small adjustments in your daily habits can provide lasting protection and help you break the cycle before it starts. Let's talk about one of the most powerful tools you have at your disposal, your diet. The food choices you make every single day can either protect your prostate or put it at risk. I'm excited to share this with you because these are changes you can start implementing immediately. Research consistently shows that a Mediterranean-style diet is especially protective for prostate health. This means focusing on fresh vegetables, fruits, whole grains, healthy fats like olive oil, and moderate amounts of fish and poultry. These foods provide antioxidants and anti-inflammatory compounds that help keep your prostate functioning optimally. Let me give you some specific examples. Tomatoes are absolutely fantastic for prostate health due to their high lycopene content. Lycopene is a potent antioxidant that's been shown to reduce the risk of prostate problems significantly. You can get these benefits whether you eat tomatoes cooked, raw, or in sauces. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts are also powerhouses when it comes to supporting cellular health and reducing inflammation. I know, Brussels sprouts aren't everyone's favorite, but they're doing incredible work for your prostate health. On the flip side, there are foods you'll want to limit or avoid. Diets high in saturated fats, red and processed meats, and excessive dairy have been linked to increased BPH risk. These foods can promote inflammation and hormonal imbalances, making prostate symptoms worse over time. Here's what a prostate-friendly day might look like. For breakfast, try oatmeal topped with berries and nuts. For lunch, enjoy a colorful salad with grilled salmon. Dinner could feature whole grain pasta with tomato sauce and a side of steamed broccoli. For snacks, reach for fruits, seeds, and a handful of walnuts. Remember, this isn't about perfection. It's about consistency and making gradual improvements that you can sustain over time. Even small changes can lead to significant improvements in your prostate health over the years. Now, let's talk about movement. Regular physical activity is absolutely crucial for prostate health and preventing enlargement. The research on this is crystal clear. Men who stay active have a lower risk of BPH and experience fewer urinary symptoms as they age. The beautiful thing about exercise for prostate health is that you don't need to become a marathon runner or spend hours in the gym. Simple, consistent movement can make a profound difference over time. Walking is one of the most accessible and effective forms of exercise for men of all ages and fitness levels. Just 30 minutes of brisk walking 5 times a week has been linked to improved prostate health and a significant reduction in BPH symptoms. Moderate activities like cycling, swimming, or even gardening can provide similar benefits. Aerobic exercise is particularly powerful because it reduces inflammation and improves blood flow throughout your body. These effects don't just support prostate wellness, they benefit your heart and metabolic system as well. Studies have found that men who engage in regular aerobic activity are up to 25% less likely to develop significant prostate enlargement. The key isn't intensity, it's consistency. Gentle, regular exercise helps lower inflammation and supports healthy hormone balance, both of which are critical for prostate health. Even small daily efforts like taking the stairs, stretching, or adding extra steps to your day add up over time. Many men worry that it's too late to start exercising, but research shows that the benefits begin as soon as you become more active. Regardless of your age, the goal is to find activities you genuinely enjoy and build them into your routine naturally. Now, here's something that might surprise you. Some common medications that you might be taking could actually be working against your prostate health. I see this frequently in my practice, and it's something every man should be aware of. Over-the-counter antihistamines, decongestants, and tricyclic antidepressants are among the main culprits. These medications can tighten the muscles around the urethra or reduce bladder function, making it even harder to urinate when the prostate is enlarged. Antihistamines, which many people use for allergies, and decongestants found in cold remedies might seem harmless, but they can have unintended side effects for men with BPH. They work by blocking certain signals in your body, which can interfere with the natural flow of urine. Tricyclic antidepressants, prescribed for mood disorders and sometimes chronic pain, can also impact urinary function. They may affect the bladder muscles or interfere with the nerve signals involved in urination. I want to be very clear here. Never stop or start any medication without consulting your healthcare provider. A knowledgeable doctor can help identify safer alternatives or adjust dosages to minimize urinary complications. Open communication about all the medications and supplements you're taking, including herbal remedies, is absolutely essential. This brings me to one of the most important aspects of prostate health. Regular medical monitoring. Consistent checkups with a urologist aren't just a precaution, they're essential for early detection and intervention. Many prostate problems, including BPH, can progress silently, so relying on symptoms alone is rarely enough. Key screening exams should become routine for men, especially after age 50 or earlier if you have risk factors we've discussed today. The PSA blood test, which measures prostate-specific antigen levels, is widely used to identify potential issues early. An elevated PSA doesn't automatically mean cancer, but it does signal that further investigation is needed. This test is usually paired with a digital rectal exam, which gives doctors a fuller picture of your prostate size and texture. I know this exam makes some men uncomfortable, but it provides invaluable information that can't be obtained any other way. Ultrasound exams may also be recommended to assess prostate volume and detect structural changes. This non-invasive imaging technique helps doctors catch problems that aren't yet causing symptoms. Knowing when to seek medical help is crucial. Sudden changes in urinary habits, blood in your urine, or persistent discomfort should always prompt an immediate visit to your healthcare provider. Early intervention can prevent minor issues from becoming major health challenges and may even protect your kidney function in the long term. But routine monitoring isn't just about finding problems. It's an opportunity to strengthen your prevention plan. Your doctor can provide personalized advice, track your progress, and adjust recommendations based on your evolving health profile. Let me give you a clear action plan that you can start implementing today. First, understand your risk factors. Talk to your family members about their health history. Knowledge is power, and knowing your genetic predisposition helps you make informed decisions. Second, focus on your diet. Start incorporating more tomatoes, cruciferous vegetables, and Mediterranean-style foods into your meals. Gradually reduce your intake of processed foods, excess red meat, and high-fat dairy products. Third, get moving. If you're not currently active, start with just 15 to 20 minutes of walking daily. Build up gradually until you're getting at least 150 minutes of moderate exercise per week. Fourth, review your medications with your healthcare provider. Make sure they're aware of everything you're taking and discuss any potential impacts on your urinary function. Fifth, schedule regular checkups. If you're over 50 or have risk factors, make sure you're getting appropriate screenings. Don't wait for symptoms to appear. Remember, your genetic background and hormonal balance matter, but they don't define your destiny. Armed with the right knowledge and taking proactive steps, you can significantly minimize your risks, even if BPH runs in your family. Prevention isn't about perfection, it's about consistency and making small, sustainable changes over time. Every healthy choice you make today is an investment in your future quality of life. I want you to know that you're not alone in this journey. This community we're building here is all about supporting each other and sharing knowledge that can truly make a difference in our lives. If you're experiencing symptoms, please don't wait. Reach out to a healthcare provider and get the support you deserve. Early intervention always provides more options and better outcomes. The power to prevent prostate enlargement truly lies in your hands. The choices you make today set the stage for better health tomorrow. Stay informed, stay proactive, and keep making those small improvements. Your body will thank you in the years to come. Thank you so much for spending this time with me today. Your engagement and support mean the world to me, and I'm so grateful to be part of your health journey. If you found this information valuable, please give this video a thumbs up. It really helps more men discover this crucial information. Don't forget to subscribe to our channel and hit that notification bell so you never miss our latest health insights. I'd love to hear from you in the comments. Share your thoughts, your questions, or even your success stories. Together, we're creating a community that truly cares about each other's well-being. Remember, prevention is a lifelong commitment, and every step you take counts. I'll see you in the next video where we'll continue exploring ways to live our healthiest, most vibrant lives. Until then, take care of yourselves and keep making those positive choices for your health.